That's right. CNN has asked viewers to send in their questions about coronavirus, and there's a lot of questions out there and a lot of confusion. So let me see if I can get to at least a few of the questions, some of the biggest ones that we're getting. First of all, who is most infectious when it comes to coronavirus? This is an important question. Just yesterday, I spent time with the head of the CDC, the Centers for Disease Control, who basically said, look, when it comes to people who can transmit the virus, it is very clear now that even people who don't have any symptoms, who are not ill at all, but are carrying the virus in their bodies, can still transmit this. So that's obviously of concern, but they also added that people who are the most sick, people who are actively coughing and sneezing, they're going to be the ones who are most likely to actually spread the virus. They're actually spreading the virus through these respiratory droplets in the air. Sometimes that can directly affect people, or those droplets can get on surfaces. People touch those surfaces, then touch their nose or their mouth. That's a common way that these viruses are transmitted. So the basic rules for any kind of cold or flu are the same. If you are sick, stay home. If you are healthy, stay away from sick people. Wash your hands often. If you don't touch surfaces as much as possible, and don't touch your nose and your mouth or your eyes after you touch these surfaces. The basics do apply here. Another question, is this more dangerous than the flu, than the seasonal flu? This is such an important question, and I want to make sure we're providing the right context. You've heard the numbers of people who are infected with coronavirus and how many people have died from coronavirus. You can look at the numbers on the screen. Now look at the numbers for seasonal flu this season. 14,000 people in the United States alone have died of the flu, and there's been 26 million or so infections of the flu. So you can see that the absolute numbers obviously are higher, more infections, more deaths, but the ratio is much lower with the flu, the fatality ratio. So these numbers are moving numbers. So it is true that flu is something we absolutely should be paying attention to, but we don't want to minimize the impact of coronavirus. This is a new virus. We're not exactly sure how it's going to change. We don't know exactly how it's going to behave. So there's still a lot of open questions about the coronavirus. Is there a cure? That's another question. Again, keep in mind, we're dealing with a virus that we've just started to learn about over the last several weeks, last couple of months. So scientists are busy at work trying to best understand this virus, exactly how it's going to behave. There is no cure yet, but that shouldn't surprise you. There is no cure for the common cold. There's no cure for the flu as of yet. There's a vaccine that's different than a cure. So when it comes to this coronavirus, the way that it's typically treated is symptomatic treatment. Treat the symptoms that someone has as a result of the infection. I should point out, and this may be a little bit of good news in all this, that there seems to be a large percentage of people who, even though they're infected with this coronavirus, have very few, if any, symptoms at all. So we don't know exactly how many people count, because those people may not go to the doctor, they may not go to the clinic, they may not get tested. But that's another reason why that fatality ratio when it comes to coronavirus may be coming down. No cure as of yet, but symptomatic treatment for sure.
This is going to, obviously be a significant investment.
On the same day, the CDC confirmed the 15th U.S. coronavirus case. I went inside the agency's Emergency Operations Center with Director Dr. Robert Redfield.
How good is the public health infrastructure at reporting in?
To give you an idea of how rapidly the situation is changing.
By the way, the numbers changed. I can tell you that it's actually 15 there.
It's a lot to keep up with.
What is the worst case scenario here in the United States?
So far, we've been able to contain it, but I think this virus is probably with us beyond this season or beyond this year, and I think eventually the virus will find a foothold and we will get community-based transmission, and you can start to think of it in a sense like seasonal flu. The only difference is we don't understand this virus.
Which is exactly why the CDC wants to be on the ground in China. It's probably Redfield's biggest frustration.
Right now, there's no evidence to me that this outbreak is at all under control. It's definitely not controlled, and the sooner we can help them get it under control, the better for the whole world.
So I guess that does raise the question, why are we sitting here in Atlanta talking about this versus the CDC being in China collecting some of this data?
I don't think it's a medical decision that we're not being invited in.
What do you think it is?
Well, I think it's above the medical.
You think it's a political decision?
I think it's above the medical. I don't think the director of CDC is making that decision.
You think it's a political decision?
Well, I think it's, all I can say is I think it's above the director of CDC because I know he would love to have us a system.
China has accepted help from the World Health Organization. The CDC is waiting to hear whether it's going to be a part of that team. In the meantime, Redfield says his priority is to keep Americans safe.
Our whole issue right now is, as I said, aggressive containment to try to give us more time, but it's going to take, 1 to 2 years to get that probably developed and out, to prepare the health systems to be able to be flexible enough to deal with the potential second major cause of respiratory illness.
And as you say, Sanjay, there is still so many unknowns when it comes to this virus, being so new. In terms of treatment, vaccines, where are we at? Because there is some suggestion from officials in Wuhan that blood plasma from survivors could be used as a treatment.
Yeah, no, it's a really interesting idea, and I've seen this idea come up with previous outbreaks as well. It's a simple idea. When someone's been infected, their body starts to make these natural antibodies that help fight the infection. Their blood now has those antibodies. If you take someone who is a survivor or someone who's gone through this infection, recovered, take their blood, you may be able to use their antibodies as a sort of vaccine for other people. That's the idea. It doesn't always work, but sometimes it can, and short of a vaccine, it's a potentially good option. And keep in mind, the whole reason behind these containment strategies is not because we believe that we can protect certain countries from a little virus. Viruses don't respect borders. It's all about buying time so they can figure out if strategies like the one you're describing actually work.
I fetched my result. It's positive. So I have been chosen.
This 21-year-old college student, who asked we call him Tiger Yi, says he was attending language courses at a school in early January near the Wuhan seafood market, believed to be ground zero of the virus. Yi started feeling sore and sick to his stomach in mid-January. Initially, he tried treating it with cold medicine, but with each passing day, it got worse.
My dad realized that maybe something wrong has happened. So my dad urged me to back to home immediately.
He then started running a fever and decided to go to the hospital.
It's a real mess. It's a lot of people and a lot of nurse and doctor in the fever 发热门诊怎么说 fever 什么
Fever clinic.
Yi eventually found a less crowded hospital willing to test him. His positive diagnosis gave him quick access to antiviral drugs, which he says proved effective. Within a week, he said he was already feeling better. Video chatting with us from a nearby city, this 31-year-old Wuhan engineer describes his initial diagnosis.
I was scared and fearful, having contracted this disease.
He said getting tested took days because of scarce hospital testing resources. When his case was finally confirmed and he was admitted for treatment, he felt confident that he could battle through the illness.
I think for the young and the strong, the disease is more like a heavy cold, only that it is highly contagious, so it causes panic.